children. So Giti, are you ready?
Yes.
Thank you. I really appreciate you connecting, and I really, really appreciate the kind of work that you're doing. I believe you're the only one in Denmark who's doing the kind of work that you're doing. So if you can kindly tell
Yes.
people, what exactly are you doing, and how is it that that's so different, so profound, so unique, that you're the only one doing it?
Yes. Okay. I am a medical doctor, and I've been it since 1983, and I'm a specialist in child and adolescent psychiatry since mid-90s. And I've been working in hospitals, and I was really happy working there for many years, and I thought I was going to stay there forever. But some political changes made it more difficult to be there. And at the same time, I met MetaHealth and trauma healing. And these two parts together made me change my work, so that since 2013, I've been working in my own private practice, trying to combine my medical education and therapy I've learned in this child psychiatric wards and the trauma healing and metakinetics. Because metakinetics, I'll talk more about that. I've learned that through MetaHealth. And my belief now is that there's a trauma perspective on all diseases, mental or physical diseases. And working from that perspective helps people. And the families who find me are families who want help for their children or their youngsters, preferably without medicine. So I don't use medicine. I did that in a hospital, of course.
Wow. A psychiatrist who does not use medication and is capable of getting beautiful results. And isn't that what's the need of the hour? I'm not saying medicines are bad. Sometimes you do need medication, but
Yeah.
how about using another way where if you don't put any more chemical inside you, you still have a way out? And I don't think many people know about it. Before you go further, I would also like to tell people metakinetics was taught to her by Robert Wagmare, who is in UK, and you can actually learn this with him. And there is a video of what metakinetics is already on my channel. You can go and avail that to have a look of what is metakinetics. Continue with you. Thank you.
Okay. In Denmark right now, there's a huge group of people who are protesting against any kind of alternative treatments. Wow. So they're really fighting against it as much as they can. Also, journalists and medical doctors and politicians working against it, trying to put it down and to make sure that nobody's doing it and talking badly about it. So it is a challenge to go on with it and to do the work, but as somebody said, don't put your head inside that rope if you can see it. So finding a balance in how you do the work. I've also mingled in some discussions where I had people talking negatively to me, and I don't need to do that. I do my work, and sometimes I teach, and that is okay. I also have some children who get referred back to the psychiatric hospital, and then they criticize me for what I'm doing because they don't believe in the way I'm doing it. But that can be solved too. Oh, my screen goes down. Okay. But all the people that I see, I have to do as a medical doctor, I have to investigate about the history of mother and father and the baby, the child. I talk about food and sleep and exercise like other doctors do, and I have to make a diagnosis. So I do, but I don't send it anywhere. I just keep it in my papers. And then I do therapy. And therapy is where the difference comes in. because I work trauma focused and from MetaHealth. I don't talk very much to all the families about the MetaHealth thinking, actually. I advise them to read something about it, and then I work with MetaHealth or metakinetics. And when I work with metakinetics, I don't tell them everything about what shows up organ-wise. I tell them what comes up for emotions. And metakinetics is MetaHealth kinesiology. And kinesiology is okay for them to accept after a few times when they sort of accept that that is possible. So I ask the body, what is the trauma that the body is ready to get rid of just now? And then afterwards, I give the pieces back like pieces of a jigsaw puzzle and try to put it together with them. Sometimes if it's younger children, I don't talk so much about it. Then afterwards I talk or write to the parents to explain them what happened, because some of the children don't want to talk about things. And then I put more into the metakinetics than just balancing the energy system. In the end, I do therapy in the end too. So I put in TFT or deeper trauma healing or whatever method that I've learned, and other people use other kinds of therapy. So it is not only testing and balancing, it's also therapy, deep trauma healing. And most children are very good at it. Even though they don't understand, they don't need to understand. Most of them don't need to understand, but they can participate. But I will also say that most of the children I see have anxiety of some kind, either PTSD or complex PTSD or separation anxiety or other kinds of anxiety, sometimes covered up and presenting itself with behavioral issues. So some people in the schools, they say, I cannot see that he is anxious. He had behavioral problems and he's acting out. They don't see what's underneath. But then we try to talk about that. And very often they have an anxious mother or father. And when possible, I also work with the parents. And that also takes some of the work from the child, so they don't have to do everything. So working with mother's anxiety helps the child with the child's anxiety. And very often it shows up to be generational traumas. And that means that the mother or the father can do a lot of work for the child. And some of them want to do it. And some of them leaves it all to the child. It's very different. I also teach all of the families to do EFT or TFT or TAT or deep breathing from HeartMath Institute. I teach them to do some calming work at home every day, preferably every day, because they come to me every 2 weeks, for example. And if they work every day at home, then they get more out of the treatments in my clinic. And sometimes I try to have it like they have to do it, otherwise they can't come to my clinic if they don't do their homework. But some families don't have the energy to do it. But I talk a lot about them doing their homework, because then it goes more quickly, because it can be very long therapy. They can be 1 year, 2 years, 3 years sometimes. And it's a very long time, and they might be able to shorten it by doing more homework. But another thing that makes it very long-lasting therapies is that I can help them doing therapy, but if they are triggered every so often from not understanding school people or not understanding parents or whatever can happen, then then the therapy is not going to work so well. And that is, I can try to go to meetings and tell them how to do it, but I cannot control the external environment in that way. So that can prolong the therapy. Yes. So working with parents, not only children, and it takes time, and be aware of the triggers is important. I have some case stories I could talk about. Yeah. So I'll talk about the different kinds of anxiety children or children with anxiety that I see. One group is adopted children, some from Africa, some from South Africa or Vietnam or other countries. I see one boy, for example, who was adopted when he was 4 or 5 years old from an orphanage. That is very late to get adopted. And he was left from his mother, of course, when they are adopted, and he really felt abandoned. And that is a big issue. It comes up again and again. And he was also sexually abused at the orphanage, but he didn't talk about that down there. He talked about it recently, at first to his adopting mother, and then after some years, he could talk to me about it. But that has been really difficult for him to talk about. So he has, from my colleagues, he has an attachment disorder, and he's intellectually okay, but he works slowly, and he's not very good at remembering. And I believe that trauma makes his cognitive functions worse, so that he works more slowly and his memory is compromised by trauma. So I would hope that if I could go on working with him, then he could function better. And I've made some tests with him, not tests, I mean, I don't take blood tests or anything, but I have some questions that I send out to him. And from we started, and after 1 year, he performed, or his scores were a lot better after 1 year. And now I've just asked them to do it again after some more months to see. But I can hear from them that he is getting better. But it is a slow process, and I have not been meeting with that school. But there are triggers in the school all the time, so that makes it the process more slow. And I have another adopted boy. He's also 11, 12 years old, adopted 1-year-old. So that is as a younger boy, but still he had a very, very turbulent time before he got adopted. And even before he arrived at the orphanage, he was with one woman and then with another woman, and nobody really knew who the mother was. And it was really terrible. So he has a lot of confusion in his energy system. And he has also been diagnosed by my colleagues in the hospital having a hyperkinetic disorder, and that is ADHD with behavioral disease. So he receives medicine from them, not from me, but from them. And it does help him. And I'm not negative about that. It's okay. I just prefer not to be the one who does it, because it takes such a lot of time and so many control visits, and then I cannot do what I'm doing. And as you said, I'm the only one in Denmark working that way. So I will preferably not spend my time concerning about medicine. But of course, there are some children who cannot profit from my way of doing therapy. And then I try to help them to some of my colleagues where they can get medicine or other treatments. But if they can cooperate to this energy work, then I don't use medicine. This second boy, he's doing really good, and even though I haven't known him very long, yes, I have two girls who are similar. They are not adopted, and they are very anxious. Their anxiety scores are very high, but they are different in a very important way. One of them is sexually abused, and she talks about it, and her father did it, and that is accepted from the system, and she doesn't see him. The other one is not sexually abused, but she has some generational trauma going far back in the family, where it comes out in the testing in metakinetics that there's PTSD further back in the family. And I think that that is why they are so alike. They have very strong anxiety. It's difficult for them to go to school, and they are very quiet and shy when they see me. But I know, which is typical, at home they can shout and they can fight with their sisters and brothers, and they can get really annoyed and angry. And one of them even has a boxing ball to push with, and the other one is jumping on a trampoline to get off, get some of the energy out. So they're very alike, and even though in this life they have a very different situation, but if you look all the way back, then they become similar. And they are difficult to work with, actually, because the two boys, they are very interested in therapy and they are cooperative. But these two girls, they don't want to talk about it and they don't really want to participate. They wanted somebody else to come and take it away from them. That would be the most easy for them, of course. And they, like, if they're feeling good, they don't want to talk about it. They just want to push it away. And if they're feeling bad,
I love the way you're saying they just want someone to come and take that trauma away from them.
yeah.
Wow, that was such a brilliant expression. Yeah, thank you.
Okay, that is really how they feel. If I guess, I think that is how you feel. Somebody else, it's not fair that you should do all the work because you're feeling so bad. Why should you do the work? You want somebody else to do it. Yes, they say. So actually, for both girls, I've talked to the mothers and say, you can do some of the work for them. So we can do surrogate metakinetics, where the mothers come to my clinic and I work with them as if the girls were there, but they're not, they don't have to come. And that can help. I've done that several times. So that can do the work so they can stay at home and play and go to school as much as they can go to school. Because they're not, maybe it's also they're not old enough or mature enough to take responsibility. They can say, I would like to feel better. I would like to be able to sleep and play and go to school. I'm sorry, the screen goes down all the time.
No problem.
They would like to feel better, but they don't want to do it themselves because they're not mature enough to take responsibility for it. And I can actually, I understand that. They feel like somebody else do the work. I have suffered enough. It's not my turn now. So we can do the work through the mothers for a while, and then maybe the children can come back and do some work. Then I have one boy who is actually quite sort of normal in an ordinary Danish family, suspected of ADHD from he was very small. He was very active, physically active and impulsive, and stopping people from talking because he wanted to say something. And And they managed him before he started in school. But when he started to school, it was okay for the first few months. And then he was too sensitive actually. He couldn't take all the other children and the fighting in the breaks in school time. So he had to get out of that school. And in the school, they talked to the parents all the time saying, I think your boy has ADHD, you should get some medicine for him. And they were not ready for medicine. So they took him out and had him at home for a while, and then he started in the next school, and the same thing happened. And now he's actually been homeschooled, as they call it. Many children, actually, there's a big group of children who are homeschooled. So that means that the mother is doing the schooling at home. They get material with other homeschool children, so they're not socially isolated. So I think they're doing a good job. And he's been doing that for 2 years now. And he's actually developing very good. And I have not known him for very long, but he has also learned to do EFT at home and TAT at home and breathing, and that does help somewhat. But what really helps, he can feel it and the parents can feel it, is metakinetics. That is where the change is happening. And it makes a big change for him. And recently we had him tested by a psychologist for his intellectuals, and also because I was a little afraid he might have autism. I was not sure how his social capacities were, and he doesn't have autism, but he had some problems with his attention, so ADHD-like difficulties. And the parents still wanted to wait a while before they might go to somebody to get medicine, but they wanted him to get more treatment in my clinic also because the boy wanted it himself. He was positive and cooperative. And after 1 or 2 more sessions, the mother gave a brilliant example of a math exercise where he could do some things, and a very complex one actually. He had to keep track of many things. So it really seems like the metakinetics can help even with that sort of cognitive and attentional problems.
Wow.
So of course we will follow along, and it's different. Some children develop very well from this treatment, and for some children it seems like it takes a longer time and only small changes each time. It's very different. But this boy is really, really good. So I don't know what the difference is. He's very open, and his body is very open for the therapy. So it works really well with him. I have 2 more. How much time do I have?
Take your time.
Is it okay?
Yeah, absolutely.
Okay. So I have a girl who is 15, and she had very diffuse symptoms. She had some physical symptoms, and she had been to hospital, to a pediatric ward, where she got examined thoroughly 2 years ago, and they said there's nothing wrong with you. And that is important for me, of course, that somebody else has said there's no physical disease here. And then they were recommended to contact me. And this girl has had very big difficulties in the group of girls, and she had difficulties going to school. And in these 3 months where the schooling, because of COVID-19, has been online schooling, she has just been at home. She has not been able to connect to the online teaching. So she has not participated in that because she didn't have the energy and she was tired and lonely and she didn't see many friends. She had a few contacts of other girls, but not very much. And she was nearly sort of giving up when I met her the first time. I started with her online. I've done online treatment and online metakinetics is possible too.
Oh, I didn't know.
But then after 3 months, I've met her. Yes, I do metakinetics online by testing on me, like
Wow.
surrogate testing on me on her behalf.
Wow, I
And
didn't
it
know.
works. No, I had the idea from somebody else, and we've also met someone from, I think, New Zealand, who didn't come to England for the training. She had to train herself in metakinetics because it was too far to go. So she taught herself. And I thought that is not possible, and I would not be able to do that. But it is possible. So when you have to, you can learn it.
Yeah.
But she was very happy to come into my clinic and see me in real, and that was different. But a lot of treatments can be done online. So now we change between, sometimes she comes in and sometimes it's online because of the situation. We still have to do as much online video as possible because there are more and more cases around here. But she has a family line to Greenland, and I don't know how much you know about Greenland, but from what we know, the Danish people have been traumatizing the Greenland people many years ago, and maybe still are. They're suppressing their culture and bringing in sugar and alcohol, or they did that when they started to come to Greenland. And many people in Greenland moved from their fishing towns into bigger cities where they were unemployed, and they started drinking and eating sugar and not functioning very well. And there's a lot of alcohol abuse and also abuse of children, and many people are not functioning very well. Many are, but many are not, and it's not because they're bad people, it's because we have suppressed them actually, or the people before us. And she had some further back in the family who had mental diseases, not clearly defined, maybe because there were not psychiatrists in Greenland who could do that and treat them properly. And what I hear from the mother is that the girl has symptoms which are in some way like the others in the family further back.
Okay.
So with her, I have to talk, like with some of the others actually, that in a way it's not fair that you have these symptoms because it's not really your traumas. You're carrying somebody else's traumas. And you can say it's not fair, but on the other hand, we can say you're able to solve these traumas and to treat them, and then you can get better. And maybe it can help them to, if they're still alive, and maybe also if they're not alive. Some believe in that, and many of them don't believe in that. But she's very open for that, and now she's starting to go more to school again. She has had problems in school, and after these 3 or 4 months at home, it's now a new school year, and she has to start again. And she's getting tired and a little headache, but she's doing it, and she's motivated, and she's believing that it's possible to get better. So she's actually also developing very quickly, like the boy with ADHD. So that is, for me, very good to have some children who profit quickly from this therapy, because some of them, it really takes a long time.
So Kiti, tell me how different it is to work with kids, and how different it is from working with kids and with adults. What's the difference? What's a major difference?
Some of the children are very open-minded. Some are not, and I don't think I see many of them. I tend to see the children who are very open-minded, and they're very intuitive. And for example, if I have to balance their energy system with tuning forks, I have sort of 8 tuning forks of different colors and different chakra relation. I can show them to the children, and I could say, which 2 tuning forks do you think I'm going to use when I test it in a moment? And then they point at them, and they're always right. It's
Wow.
really amazing. They know it. Yeah. And many of them have that. For them, it's very easy to go inside the body and to feel what happens there, and to feel that the light is coming in to dissolve the traumas, and they're doing it quickly. Many of the adults take longer time. They can still do it, but it takes longer time. The children are very quick. And it's funny and amazing to work with them.
So, Giti, when you used to work in the hospital where you were only giving medicines, and now you're not giving medicines, what's the major difference other than the medication? How do you, how did your perception change so much? What really made it kind of sit down, and what was it that made you kind of go and in search of how to do it without?
I did do something else than therapy in the hospital. We had the possibility of doing play therapy, where they had a box of sand and some toys, and they could put things in the sand in a different way, and we could talk about it. And that could help some of the anxious children really very much. And I could talk to the parents about when the child gets less anxious, then there's often anger underneath, and you have to be prepared for that, and to help the child and to welcome the anger, and teach them how to handle the anger that is coming up, because sometimes the anxiety is there to suppress the anger, which is a forbidden emotion. So sometimes we could do treatment also in the hospital.
Okay.
But how I changed perception, I think I am writing a book. And I have thought a lot about it, because many people ask me, why did you do that? Why is it not enough to work the way that you have been taught in the hospital? And I've always been searching for different ways of understanding things and the connection between the mind and the body. And it is a very long journey for me, 20, 30 years before I got here to think differently. And then I had a friend who talked to me about trauma healing. And when I went to that course, I met Lars Mugin, and he said, you should learn MetaHealth. And from the first weekend I heard about it, that just made everything fall together, and it was so meaningful for me.
Wow, that MetaHealth is like that. Dr. Varsha is asking a question, and she's saying, while treating ADHD kids, do you take mother's history during pregnancy?
Do I take mother's history?
Yes.
Yes, I always ask very thoroughly father's and mother's history, because we become parents with what we had when we were small. So I need to know, how was it when they were children? How was the emotional climate? Did they learn to talk about emotions and to feel them? And who could they talk to? And how was their social life and their education in school? And how did they meet each other? And then about the child, pregnancy and birth and development.
She's
I
specifically
think I learned that when
she's specific talking about when the mother is pregnant. Do you talk about how her pregnancy was, or is it related with pregnancy in any way?
Yes, sometimes it is. The one case more I have is actually a very troubled pregnancy, where the mother was vomiting all the time during the pregnancy. So bad. I've never met anything like it. So bad that the mother of the life of the mother and the life of the baby was threatened, both of them. And of course, sometimes the mother wanted to get rid of the baby. not to get rid of the baby, but to get rid of the pregnancy and the symptoms, because it was so bad and scaring. And the child has felt all that in the womb. And the child is a very dysregulated child. She's a lovely, beautiful girl of 9 years, but she's dysregulated. She goes to school, and that is the best for her, actually. She's pulling herself together in the school. And then she's reacting with temper tantrums and things like that at home. And it's really tough for the family. And they're doing the best they can, of course, but it is hard.
Wow. Any
But
questions?
with all the others, I also talk about how they feel in the pregnancy. Do they talk to the children? Do they sing for them? Have they an idea of what kind of child it is? And yeah, I do talk about that.
Wonderful. So I hope, Dr. Varsha, you've got your answer. Any other questions, guys? Any other questions that you may have? You can unmute yourself and ask the question. Does anybody have any question?
I'd like to ask a question.
Please go ahead.
First of all, I love your, is that me? Oh my goodness.
Okay. That's okay. There are probably angels around you right now. Okay.
Oh, that's not, oh my goodness. When I muted, did you continue hearing it?
Yes.
Yes?
Not when you were muted, but we can hear it otherwise. You can ask your question. That's okay. We'll just think it's music behind you.
Okay. And it stopped. Oh my God. Okay. So first of all, I just wanted to say that I love the approach of looking at parents, because I think, you know, a lot of parents kind of shift off the kid to be fixed, like you said, the car to a garage, but the kid is living in the context of a family. So the relationships inside the family and the parents are critical, One thing that I wanted to ask you, I know that for a lot of kids, COVID-19 has really aggravated stress and depression. So things that were mild, all of a sudden kind of erupted like a volcano. I know that with my girl, she has ADHD. So do I, by the way. And coaching is amazing to help ADD, as well as EFT and a lot of the things that you do. But what kind of tips can you give parents that feel that due to COVID-19, the social distancing, the fact that there isn't a schedule, all of a sudden a lot of the resources that children have that are seem not to be available, what tips can you give parents to help their kids stabilize and become a bit more resourceful?
Thank you for that question.
Yeah. I think I've said the same as the first one about the animals. Calm yourself, parents. Because if the parents are calm, then they can help the children. And some of the anxious children actually are doing very well in this time when they had to stay home from school, because it was nice and quiet and somebody had to stay at home with them for the first few months. And then it got too much and they needed to go out and they needed to have contact with their friends again. It's difficult to give concrete tips. I think the best thing is for the parents to calm themselves, and then they can talk properly with the children about what they know and what they don't know, what we have to do, and find ways of doing good things and funny things with the family. And in Denmark, it's said that you can see a small group of friends, and this is just the friends that you can see several times, and you can be together with them as close as you like, but not with hundreds of children, but make yourself a small group that you can see. And that is also how they do in schools and in kindergarten. They have a small group of children that they can see. Because you need to do something that is nice and funny and creative, and then you have to put up with the rest and say, well, this is just how it is somebody else is deciding what we can do and what we cannot do.
Yeah, there are too many kids around who are right now in a very big flux because they don't know what they don't know when this time is going to end, and their parents cannot give them those answers. I at some point interviewed a lot of kids during the COVID-19 when it had just started, and one kid so beautifully said that COVID, because of COVID-19, my papa is at home. That's the best thing that's happened. My papa can't travel anymore. But then there were kids who said, mothers thought that the kids didn't know about COVID and they were trying to hide. And they sat down and spoke so beautifully about saying, oh, it's just a virus. So, it's like we haven't, I think, given information to them in a way that is digestible, and we are ourselves so anxious that we're giving them information with that anxiety. Maybe you're absolutely right when you're saying that we need to calm ourselves down. Yeah. Any other questions, guys? Anybody else with any other question? Okay, so thank you so much, Geeti, for that information. It was brilliant. And do put your number down and email address in the chat box if people want to connect with you. And how can they connect with you? Just for everybody to know, I will be creating a YouTube of all the speakers today, and they will be going on my channel. I will put down, I've already put on the Facebook my channel name. You can go there and actually pick up videos from way back in time, right up till the metakinetics that Geeti's been speaking about. And that way you will really know what metakinetics is all about. Robert Wagmare actually did a case of metakinetics when he came down to India for the conference. And this is thank you for all of us. I'm just going to take everything off the